Hello everyone, hope you're all well. Welcome to our YouTube channel for Obs and Gynae training. Uh, if you like the video, please do like the video and subscribe the channel and ask your friends and family to do the same. So today we are going to talk about menopause. October was the World Menopause Awareness Month. So we thought it would be nice to give you an idea about menopause. So, what's a menopause? When a woman stops having periods, it is called a menopause, although it is a retrospective diagnosis. So, when there are no periods for 12 months, then one is menopausal. However, one should be careful about secondary amenorrhea for various other reasons. So, menopause will be stopping of periods along with menopausal symptoms, and it is quite possible that sometimes the symptoms may start before the actual menopause happens, and the area or the time frame when it's leading to menopause, it's called a perimenopause. Currently, around 1.2 billion women are menopausal worldwide. In developing world, the age of menopause is slightly earlier. In India, around 45 million women suffer from menopause and expected to rise to 103 million by 2026. Average age in India for menopause is around 47.5 years. So as you can see that there is a lot of lack of awareness about menopause, and sometimes women just carry on along with the symptoms and suffer from it for a long time. And the idea is that increasing awareness, women will be in a position to take better care of their own health and needlessly won't suffer with the symptoms of menopause. So, what are the different causes of menopause? So, natural, obviously, age related. So, the difference between men and women is men produce sperms on a regular basis, whereas women are born with a set number of eggs. And from the day they are born, this number is going down. And when they run out of all the eggs, naturally they attain menopause. Genetics, it is menopause is very closely linked with the genetics. If your mother became menopausal at an early age, there is a decent chance that you will become menopausal more or less around the same time. Smoking accelerates the decline of ovarian reserve and hence lead to an earlier menopause. Hysterectomy, which is removal of the uterus. So even when in younger patients, when we remove the uterus, we preserve their ovaries. These ovaries, because of the disturbance into their circulation, they tend to stop functioning at an earlier age. There are certain autoimmune disorders which somehow affect the ovaries and cause a decline in the ovarian reserve sooner than later. Cancer treatments, certain cancer treatments like medications as well as radiotherapy can damage the ovaries and lead to menopause, and obviously the lifestyle factors contribute to the problem. What are the symptoms of menopause? So obviously the periods stop, and when a woman hasn't had a period for 12 months along with the symptoms of menopause, then it will be called as menopause after 12 months of amenorrhea. However, leading to the complete absence of periods, one can experience various patterns till the periods completely stop. So, what are the different symptoms? They could be mental health symptoms as well as physical health symptoms. So, the mental health symptoms are mood changes, forgetfulness, lack of concentration, anxiety, depression, low self esteem, irritability, and stress. So, if you are experiencing those symptoms and if you're not on treatment, you need to take specialist help so you can get proper treatment. The physical symptoms consist of hot flushes, sleeplessness, palpitations, headaches, migraines, muscle and joint pain, loss of bone density, because estrogen is needed to maintain the bone density. And once you are menopausal, the Body lacks estrogen, which affects the bone density. That's why there is a high risk of bone fractures in older women, even with a simple fall. There are skin changes, reduced sex drive, vaginal dryness, itching, as well as pain because the vaginal estrogen is lacking, and that reduces the elasticity of the vagina. Recurrent UTIs, sensitive teeth, as well as painful gums. So, what are the investigations recommended? So, we measure the hormones like estrogen, which will be low, FSH will be very high, and usually, if FSH is above 30, it is diagnostic of menopause. Testosterone, we check in women with reduced sex drive. Pelvic examination is important because this is the age when other pathologies can occur. Ultrasound scan, it tells us about uterus, any other pathology, ovarian cysts, as well as endometrial thickness. Pap smear, which is done every 3 to 5 years, which is an important part of cervical screening program. Bone density scan, we use it as a baseline and then repeat it every 5 years to see the changes in the bones. Thyroid function test, mammogram, lipid profile, endometrial biopsy in women with irregular bleeding, genetic tests if somebody is menopausal at a very early age, which is called premature menopause, and mental health evaluation is also suggested. What are the treatments for menopausal symptoms? It is called hormone replacement therapy. It would be given systemic, which is in the form of tablets, gel, or patches, or local estrogen cream to apply vaginally. Androgens are offered to women with reduced sex drive, but we strongly recommend that you start these treatments only after proper consultation as well as assessment by a specialist. There are certain lifestyle changes which can help you to cope with the symptoms of menopause, and they include regular sleep and rest, healthy diet, calcium rich diet, as well as supplements to maintain the bone density, vitamin D supplements, regular exercises, relaxation with yoga, support groups, and specialist help. We hope with this information you will be better equipped with identifying these symptoms of menopause and seek specialist help if needed. Thank you.